Hello, everyone. I'm here to talk to you today about my project, which is basically my curriculum project is implementation of change of shift bedside handoff. This is basically what this is that when nurses change shift, if I'm the nurse coming on off shift and one is coming on, I have to give a report on what's going on with my patient. So, for example, when I would like give you certain information about the patient in order to ensure that the patient is safe. The reason that this is important is because medical errors are the third leading cause of death in the United States, and this is something that is very preventable. One of the main risk factors has been found to be the poor communication during a handoff from the nurse to nurse of one patient, or doctor to nurse, or doctor to doctor when we're talking about a patient. So one of the things that I thought I could do was positively affect this statistic by ensuring that proper handoff is done. So my intent for this project is to teach nurses the format using a new tool, PowerPoint, or 3D simulation lab. Right now, I wanted to do 3D simulation lab, so we'll look at it from that aspect. So the curriculum that I have set up right now is as follows. Location. Basically, nurses are giving report at the nursing station and not within the patient room. So we would move from the nursing station to the patient room and involve the patient with this procedure under normal circumstances. And I'll go back to this after I'm done with this, why I say under normal circumstances. Expectation. I would be teaching, the nurses to know what to expect, and the patient would know what to expect when the nurses are coming in and talking about their care and trying to involve them as well in their care. We're going to invite the patients also to be an active participant, because as we're talking about their care, they should be involved and know what's going on. And that's the activation stage, which would be encouraging the patient to participate. And then we'll do observation, which would be the leadership educators like myself and other champions to make sure that the procedure is done. So we'll direct observe this education piece happening. And then we'll be using handoff checklist tools that include ipass, safety mnemonic, use of a simulation lab, and several others, just so you can see what the ipass sample verbal handoff here would be. I would be illness severity. I may say something like, okay, this is our sickest patient and he's a full code, meaning we would do CPR. The P, patient summary. For example, AJ is a 4-year-old boy with a history of 26-week gestation. So you will see what's happening here in a summary of the patient. And an action list would be things that need to be done. I may say, hey, can you make sure you give him hot water with his dinner? He likes hot water. S is situation awareness and contingency planning. For example, as it says here, if his respiratory status worsens, please get another X-ray. Things like that, and then synthesis by the receiver. So this will basically be a chance where you can see if the communication was effective, because the nurse would need to repeat key information back to you. So that is the one of the key things with that. And here's another sample of how the format could look in a computerized version. And also up top here, this is actually a company that has, the ipass Patient Safety Institute has actually developed a SIM program. So I guess I could purchase that and then to implement it for you. So as you can see here, here's the patient name. The nurses would actually be able to practice their voice recording and get real-time feedback after it's done from this program. Now, it said name some challenges or concerns. I have so many challenges and concerns right now with what's going on with COVID-19. It's almost impossible for me to focus on this task. I just read, for example, what my plan was, which was to move the nursing station to the patient room. And about 2 to 3 weeks ago, that might have been the normal thing to do, but right now we're doing everything to stay out of the patient's room. We're trying to put patient cameras in rooms. We're even keeping family and visitors out. I know I'm going off on a tangent, but there has been a lot happening, and I am trying my best to complete this course throughout all of this. So I hope you all have a wonderful day.